Back to CW Iowa Live. Lou along with Michelle Brown in for Jackie because Jackie is en route to Indianola right now. Somebody has to ride in the balloons.
Take a balloon ride this morning, yes.
And it just so happens to be Jackie.
She's the perfect gal for the job.
But we were just talking about the fact that if you look at the calendar, you realize that it's not even August yet, but if you go into some stores, there is school stuff everywhere.
So, I know, it's hard to believe. Yeah.
So
Summer's going to be winding down before we know it.
Getting ready to go back to school, and with that in mind, we have Dr. Caitlin Padaki joining us. She's the state epidemiologist and state medical director. And I know what you're saying. Wait a minute.
That's a mouthful.
I thought that was Dr. Quinless, medicine woman. But she's retiring.
She is. You know, Dr. Quinless is just so fantastic and has had such an incredible career. And I've had the pleasure of getting to know her over the past month or so. And we're sort of overlapping until her retirement at the end of September.
Really? So you said you're getting to know her. So where are you from then?
I'm actually originally from the Washington, D.C. area. And I've been in Nebraska for about 3 years now.
Wow. How about that? And so how did you find out about this opportunity then?
You know, the public health world is sort of a small world. And, you know, I knew a little bit about the people who she works with, and I was right over the border, so it was an easy transition to make.
Well, you're going to find
it's
nice, as nice here in Iowa as it is in Nebraska, and you're probably going to find out it's a little nice.
Yes, I have been told that. Yes.
All right, but we are here to talk about back to school and some things that people need to keep in mind for back to school.
Yeah, so you know, as a pediatrician and as an epidemiologist, you know, I always love talking about vaccines. They're just such an important way that we can protect our kids when they go back to school. And of course, that'll be happening soon for many Iowans in about a month now.
Okay, now what about, what will you tell people that really they're afraid of vaccines? Because there's a bunch of them that are out there.
That's true, and I can tell you I've had conversations about vaccines with people who love them and have every vaccine they can get, and conversations with people who are a little bit hesitant or concerned, and sometimes skeptical, and probably everybody in between. And I can tell you that when I have those conversations, I really believe that every parent and guardian just wants to do what's best for their child. I really think that's true. And I think that, you know, when people have questions or if they have concerns, I would really encourage them to make time to talk to their healthcare provider or to their local public health department to think about what some of those concerns are.
Well, maybe you could explain how a vaccine works, and maybe that might ease some tensions that might be surrounding it.
Absolutely. So the idea with the vaccine is really quite similar to almost anything else in life. You know, we wouldn't take a big test or run a marathon or do a piano recital without practicing, right? And this is the idea with vaccines. We want to give your immune system a little bit of practice at fighting off these sorts of things so that when they have to do it for the first time or in a real scenario, they're good at it, they know how, and you can fight off these diseases.
So that's the basic premise of how a vaccine works. But what about some folks who say, well, I don't want to get whatever I'm being vaccinated for?
Yeah, no. So these vaccines are very carefully studied and very carefully tested. So what we usually give is either a small piece of the germ, you know, the bacteria or virus, that could never actually make you sick, or an inactivated form that also tends not to make you sick. Now, sometimes people will have symptoms after they get a vaccine.
Yeah, because some people say, oh, I got a shot for this, a vaccination for this, and I got whatever it was for.
Yes, so they might even feel some pain at the injection site, they might feel tired, they might even have a fever. But actually, all of those things are your immune system doing what we want it to do.
So a fever is actually, to a certain point, a good thing?
To a certain point it is. A fever is a normal, healthy reaction that your body has to things that shouldn't be there. And so getting a fever tells us your immune system is working and it's learning how to fight these things.
So that's a good thing.
I believe I was here the last time she was in talking about, there's some new vaccinations and different things that there's been some changes to requirements for this year,
There is a change for Iowa this year. So this year we're asking our 7th and 12th graders to get the meningitis vaccine, which will be new this year. And that's an important one because although there are many different types of things that can cause meningitis, one of the scariest is a bacteria called Neisseria meningitidis. And that bacteria is so scary because it can make you very sick very quickly, and it can kill you.
Oh, really?
It can. And so, you know, the good news is we have this vaccine that works well. And so, you know, this has now become a part of the set of immunizations that we will ask our students to have in Iowa.
How many different immunizations are the students required to have?
Oh, gosh. There are several, and they're all listed out very nicely on the Iowa Department of Health Immunization Program webpage. and they roughly follow, you've probably heard, the Advisory Committee for Immunization Practices, or ACIP. So they're roughly based on that, and you can kind of follow them through to see what ages you need to have certain things at.
So if the people do want to learn a little bit more about each of the vaccinations and just kind of get, you know, a little bit more familiar with what all is involved there, they can go to the website.
Yes, absolutely. We would love that. And there's some great resources there, you know, and you can also reach out to your healthcare provider or your local public health for more information.
Okay, what about some parents that may be concerned about the cost of a vaccination?
Yeah, so one of the nice things that the Iowa Department of Health Immunization Program does is they partner with a lot of organizations across the state. You know, vaccines aren't just a public health or a health issue, right? It involves parents, kids, schools, a lot of people who are interested in making sure we protect our kids from these diseases. So one of the things that we can do is offer programs like Vaccines for Children, which can help for that cost, help pay that cost if somebody can't afford it.
Yeah, because I think for the vaccination is not only for the person getting the vaccination, but those that are surrounding, from, if I understand correctly.
Absolutely. So the way that some of these, and the whole reasoning behind having these requirements associated with school is that, as we all know, if you put a group of people into a room, whether it's a family reunion, a sporting event, a school, there's the possibility that germs can move from one person to the next. So what we're trying to do is limit that spread. And with some of these bugs, the more people you have vaccinated, the more protection it can give to people who might not be able to get that vaccine, say if you're a very little baby or if you have an immune deficiency. Those are the types of people who sometimes can't get them.
So again, the long-term effects of it too.
Yeah, it really helps protect our kids and our community overall.
And I think the more people learn and know about them and be able to reach out to you guys and find out more, that's very helpful. And their healthcare provider that, you know, helps with the concerns.
Absolutely.
And the more educated we are, the better.
Yes,
right?
yes.
That's wonderful. So, all right, for more information, what's the easiest place for people to go?
For more information, visit us on our webpage. Our immunization program has a lovely page that has tons of information for you, and you can always reach out to your healthcare provider and local public health.
Well, wonderful. Dr. Caitlin, thank you so much for coming in.
Thank you, my pleasure.
And we hopefully will have you back on a regular basis.
Yes, that sounds wonderful.
Wonderful.
Thank you.
Thank you so much.
Sounds good. Thank you.
It is 20 minutes past 7 o'clock right now. Don't go too far. We will be right back. This is CW Iowa Live.